Well, here we are today with Dr. Bondarev, a chiropractor, and actually in Van Nuys here in California. But Dr. Bondarev is really actually, more than a chiropractor. But Dr. Bondarev, why don't you tell us, please, of what your philosophy about chiropractic is? Because every chiropractor has a different philosophy. Every doctor in every discipline has a different philosophy. And tell us what people can expect when they come to you. Why should they come to you? What are the illnesses or alignments which you are curing? And by the way, Dr. Bondarev, if you don't mind tell us how you became a chiropractor. What brought you to becoming a chiropractor?
First of all, answering your questions, people have to realize that chiropractors work in so many different directions. There are some chiropractors who work more, so to speak, in a holistic medicine, and they try to maintain health of patients in a certain pattern, which actually manifests itself through regular visits, let's say couple times a month, couple times a week to the rest of their life. And I highly respect that position, but it's not the kind of medical art I'm practicing. My background, first of all, I'm European, as you can hear my accent. I graduated from medical school in former Soviet Union. I was working in the city of St. Petersburg. And we did not have chiropractic per se as a profession. We had so-called manual therapy. Manual therapy was practiced primarily by medical doctors, and I was the chief physician of the Department of Manual and Physical Therapy in St. Petersburg, in multi-specialty facility. When I came here to the United States, of course, I got my second education as a chiropractor. It's a very valuable knowledge that I got it here in the United States. United States is the leader in any form and shape of medical arts. But I consider myself as a, so to speak, using the jazz musician terminology, I'm a fusion guy. In my practice, I incorporate osteopathic, medical, chiropractic approaches. But as far as the general direction of the practice, I do not practice maintenance therapy. I'm strictly neuromusculoskeletal specialist dealing with the after 25 years of being in practice, I'm practicing primarily with the treatment-resistant cases. Treatment-resistant cases, the cases when people went through hell, pardon my language, and they saw a number of specialists. They went through physical therapies, through orthopedic surgeons, through neurologists. Of course, I get sometimes more simple cases, but for the past 18 years in Los Angeles, I'm known primarily in the Russian-speaking community as a specialty in a treatment-resistant case. Sometimes I consider my practice as a trash box. You know, when doctors and patients throw into my practice the people that pretty much lost the hope of getting better. That's pretty much the description of my practice.
Okay, well, tell me a little bit, though. You know, you used a couple of words which I cannot even repronounce, like muscular. Why don't you explain that a little bit? And why don't you explain, give me a little idea of what having gone through hell means. Give me some physical examples there.
Let's consider myself in villages for many, many centuries, even millennia. In small villages always were bone setters. I consider myself more bone setter than anything else. I'm dealing with things like discs as let's say, specialist in a frozen shoulder, in the shoulder problems, post-operative shoulder problems. When people, it's a very, very big issue, and it's very difficult to explain it in a nutshell. But primarily I'm dealing with the bones, muscles, ligaments, and so forth.
Okay. And are you using you said fusion. So we know that a chiropractor, he adjusts things, and he might be, telling to do some nutritional supplements and stuff like that. He might be giving a little bit of a massage, or what is are you doing that also, and something else? Explain a little bit.
I respect very much the professional offices that do nutritional counseling and these kind of things. We do not do it. We're dealing strictly with the muscles, with the bones, with the problems relating to the human skeleton and muscle. And when I say treatment resistant, for example, people go through, let's say, surgeries. Unfortunately, sometimes unnecessary, actually not sometimes, majority of cases, and they still do not get proper relief. Primarily, clinics specialize in the shoulder problems, but we also deal with the knee problems, let's say meniscal problems. We deal with the hips, we deal with the elbows, and of course, as any chiropractic office, or let's call it more properly manual and manipulative therapy office, we're dealing with the spinal problems. Pinched nerves, numbness in hands, numbness in feet, chronic headaches, this kind of stuff.
I got it. Well, wonderful. Let me ask you a question, since you mentioned that in your country it's called manipulation. What is it called? Say that again.
Let's call it manual and manipulative medicine.
Yes, manual and manipulative medicine. About 100 years ago, give or take, maybe 90 years ago or so, we had a big flu epidemic in this country, and I think in other countries also, but at least in this country. And at that time, chiropractors really didn't yet exist, but the manipulator, the bone setters, the people you described here who did work with the bones did exist. And there is apparently, and I don't know whether you can confirm that there's apparently a study out there, people who received manipulation in whichever form it came, setting the bones straight, making the pinched nerves free them up, and whatever it was, they had and I don't know the number, but a drastic higher chance of surviving that flu season back then. Are you aware of that?
Yes, I'm definitely aware of that. Again, there are some chiropractors who practice holistic medicine that pretty much is dealing with the nerve flow. And I truly believe in that. And I deeply respect chiropractic offices, especially old-timer chiropractors who work in a holistic field. And I do believe that free flow of nerve energy and these categories, so to speak, work wonderful on the people, but it's not what we do here. It's not what we do here. Again, I would rather...
Let me interrupt here a little bit here. I think what you're saying here is this is not what you set out, because people come in with relatively in bad shape. As you said, they have gone through hell. So you fix that. But by doing so, you automatically, invertibly, of course, free up the flows of the body. So a person, no matter what treatment he goes through, he will now be more resistant, has a better immune system, period, for everything else. Wouldn't that be the truth?
Yeah, that would be absolutely the truth. It would not be the major goal, but obviously, let's say if you get cervical...
That's all I tried to say. It's like, because you mentioned manipulation, and, so even before chiropractors, people sometimes don't realize that, yes, they get rid of a shoulder pain, or of a hip pain, or of a knee pain, or of a headache, and that is super, super important, because it is so impinging right now. But what people don't realize is that they have it because nerves are out of alignment, they're not working, muscles are pinched, whatever it may be, that because of it, the whole body's immune system suffers, because obviously all the force to keep the body together has to go here to make sure that the pain isn't killing you, and thus the immune system, as you said, the flow of blood, of circulation, of nerves, any flow, any stacked flow, even money. That's why they say you can't just make money, you gotta spend money. Money cannot be stuck either. And nothing in life can be stuck. So wonderful.
Absolutely.
Well, Dr. Bondarev, that was a very nice explanation. I'm glad you. It's quite interesting. So you're actually also an MD. So you always, when a patient comes to you, even though you're not practicing as an MD in this country, you do know the anatomy of a body very, very well, and you can immediately go and